The quickest and easiest way I can describe the difference between being a PA and being a doctor is that PAs are trained to clinical practice, whereas physicians are trained to the science. Obviously, this is a little oversimplified explanation, but I think it's quick, it's to the point, and it gives a lot of people perspective on the difference between both of them. Okay, for example, as a PA, I can identify that this is a congenital diaphragmatic hernia. The things I would look for would be difficulty breathing, a scaphoid abdomen, which is a buzzword. If we knew about it prenatally, we want to intubate right away so that the air doesn't get into the bowel and then expand and compress the heart and the functioning lung. I knew that this was a malformation that happened during development. I know that the lungs are underdeveloped. A lot of times these babies will have difficulty with oxygenation and many times will require ECMO. Okay, compared to medical training, and I don't want to bore you with all the details, but we had to know and still have to know, memorize through fellowship, the embryology, so what happens at each stage of development here, the septum transversum doesn't form properly, what that means. We have to know all the folds, how they all meet together, and why and where these hernias will appear through the diaphragm. The most common is the posterior lateral hernias, followed by the anterior medial hernias, and then lastly is the central hernias. We need to know that these are associated with some genetic conditions, what those genetic conditions are. A lot of CDHs are now diagnosed prenatally. We can do fetal MRIs. We look at the expected lung to head ratio to give an idea of mortality. We look to see if the liver is involved because that has increased mortality. And again, same thing, postnatal management. We have to intubate right away. We are at high likelihood of having difficulty oxygenating, so monitoring the OI, placing, when to place babies on ECMO if needed. And now there are prenatal options, so we also have to learn about the prenatal options and how that procedure works. And again, knowing that the lungs are hypoplastic, even the contralateral lung, why that occurs, so all those little details that go into it, we have to know. Again, this is an oversimplification of the differences between being a PA and a doctor. Again, one is not better than the other because I know people love to come for that in the comments. They are just different. So hopefully this is a helpful explanation. Let me know if you have any questions or if there's anything else I should discuss.